Welcome back to the show. So on an earlier explainer, we covered 5 aspects of pediatric nursing, and a ton of you reached out asking me to expound majorly on the newborn baby. Well, you asked, and today we're doing exactly that.
Okay, let's dive right into this critical period. What actually happens in those first 28 days of life? In the medical world, a baby from birth up to their 28th day is officially called a neonate. And man, it's an incredibly fragile window of time.
Here's a quick roadmap for today's explainer. We're going to cover 1. Adapting to the world. 2. Immediate newborn care. 3. Normal newborn characteristics. 4. Essential infant nutrition. 5. Managing the sick newborn. And finally, 6. Caring for premature babies.
Number 1. Adapting to the world. Birth is what I like to call the alien environment metaphor. Just think about the sheer contrast for a second. In the womb, the baby's getting oxygen directly via the placenta, their lungs are actually filled with fluid, and they're chilling in this perfectly warm, protected environment. But suddenly, bam, they're out in the world. Their lungs literally get squeezed during delivery to clear that fluid, they're suddenly forced to breathe air independently, and they face extreme heat loss through evaporation. It is a massive, instantaneous physiological shock.
Number 2. Immediate newborn care. So what do nurses do in those chaotic first few minutes? Well, there are rapid, immediate steps taken the very second the baby arrives. First up, clear the airway. You've got to suction out that mucus from the nose and mouth. Second, aggressively dry the baby and keep them warm, because as we just talked about, heat loss is a huge threat. Third, they assess the APGAR score at the 1 and 5 minute marks. And fourth, safely cut and tie the umbilical cord.
Now, you've probably heard of the world-famous APGAR score, right? It basically evaluates the baby's vital signs right after birth, giving a score out of 10 possible points. They're checking appearance, pulse, grimace, activity, and respiration, scoring each one from 0 to 2. So a completely pink, active, and crying baby, that gets a perfect 10. But the absolute most crucial point on that entire APGAR assessment is the pulse rate. If the newborn's heart rate drops below 100 beats per minute, warning bells go off. It's a major danger sign indicating the baby needs immediate clinical resuscitation.
Number 3. Normal newborn characteristics.
Okay, so once the baby is stabilized, you might notice this thick, kind of greasy, cheese-like covering on their skin. It's called vernix caseosa. Now, it might look a little weird at first, but it is totally normal. It acts as a vital protective barrier for their super delicate skin while they're floating around in amniotic fluid, and honestly, it just keeps protecting them right after birth.
Next up, we have their built-in survival mechanisms. A classic example is the Moro reflex. This is basically a startle response. If there's a sudden loud sound, the infant's body stiffens up and their arms throw up and outwards. It's just one of several amazing survival reflexes they're born with, along with the rooting reflex for finding food and the grasp reflex.
And you know, despite being totally dependent on us, a newborn is actively taking in sensory information from day one. I mean, they can taste breast milk immediately, they hear loud and soft noises, and get this, they will actually turn their little heads toward familiar voices, like their parents. Their vision starts out with weak eye muscles, sure, but their focus improves over weeks. And their skin? It looks pretty red and elastic simply because they have very little subcutaneous fat right now.
Number 4. Essential infant nutrition. It is absolutely mind-blowing how breast milk literally transforms its chemical makeup over time to perfectly match what the baby needs. Check this out. In the first 3 days, mom produces colostrum. It's thick, yellow, and absolutely packed with protective antibodies. Then, for up to 2 weeks, it shifts into transitional milk, bumping up the fat and sugar for an energy boost. And from about 10 to 12 days onward, it becomes mature milk. It's more watery, but it contains the exact, precise balance of nutrients for optimal growth. Talk about a dynamic system.
Number 5. Managing the sick newborn.
Unfortunately, it's not always smooth sailing. There are critical danger signs that every single pediatric nurse is trained to spot instantly. We're talking breathing difficulty, cyanosis, convulsions, failure to pass meconium, or sudden temperature drops. When any of these happen, medical teams have to act fast, like urgently, to prevent complications like brain damage or severe infections.
Let's break down one of the biggest threats, hypothermia. Why are newborns so incredibly vulnerable to losing heat? Well, it's kind of a perfect storm. They have a super thin skin layer, their blood vessels are really close to the surface, they have almost no insulating subcutaneous fat, and they have 3 times more surface area compared to their body mass than adults do. Heat just evaporates off them rapidly.
Another major red flag is cyanosis.
This is a bluish discoloration of the skin, and it indicates a very dangerous lack of oxygen in the blood. It's frequently linked to a condition called asphyxia neonatorum. Basically, if a baby fails to start normal breathing at birth, they can literally turn blue. That requires immediate airway clearing and oxygen therapy to prevent severe hypoxia.
And here's another critical number to keep in mind: 40 milligrams per deciliter. If a newborn's blood glucose level drops below that threshold, they've got neonatal hypoglycemia. Because their tiny metabolisms are just working in overdrive, low blood sugar can hit fast, and that causes severe lethargy, twitching, or even full-blown convulsions.
Number 6. Caring for premature babies.
When a baby arrives too early, you can actually see their physical immaturity just by looking at their resting posture. While a normal full-term baby holds their limbs flexed and tucked tightly close to their body to conserve heat, a preterm baby's limbs are just stretched out loosely along their sides. They literally lack the muscle tone, and more importantly, they lack vital survival reflexes, like the ability to suck and swallow.
Because their systems are so completely underdeveloped, preemies face extreme risks across the board. Their respiratory center might literally just forget to breathe, causing apnea. Poor digestive reflexes mean a huge risk of aspirating food into their lungs. Immature kidneys can lead to fluid retention and edema. And with almost zero subcutaneous tissue, severe hypothermia is a constant lingering threat. Nurses have to meticulously manage their warmth in incubators, carefully administer tube feedings, and be absolute hawks about preventing infections.
In these wild first 28 days, pediatric nurses do so much more than just medical interventions. They provide full-on, family-centered care. They are guiding not just the fragile baby, but also the completely terrified, exhausted parents through this miraculous and incredibly high-stakes transition.
Which brings us to a fascinating final thought for today. Knowing the extreme, absolute physiological shock of birth, how does surviving our first 28 days shape our lifelong resilience? It really leaves you wondering just how much that intense fight for stabilization in our very first month sets the stage for everything that follows in our health and development. Something to chew on. Anyway, thanks for joining me on this explainer, and definitely keep asking those great questions.